New Mexico Cancer Center and Health Specialist of New Mexico are the proud sponsor of health and wellness on New Mexico Living.
We're joined today by Dr. Chris Shukla. He is a radiation oncologist at the New Mexico Cancer Center. Chris, thank you so much for joining us today.
Oh, it's my pleasure.
I want to talk to you a little bit about radiation oncology. You're a radiation oncologist. Kind of talk to me about what you do.
Yeah, it's a great question because, I can't tell you how many times I've been confused with radiologist or some other type of oncologist. Radiation oncologist, well, at our core, we are oncologists, but we sort of specialize in treating cancers using radiation. And the way we do that over the last 40, 50 years or so, ever since we actually started treating patients with cancer, has changed dramatically. And the reason for that is because our technology has improved so much so that these days, compared to what we used to do in the past, we're much more so able to treat what needs to be treated and sort of avoid what needs to be avoided. So for a patient with breast cancer, we're really able to these days treat the majority of the breast and kind of avoid the heart and kind of carve around and minimize the amount of radiation that goes to the heart. And that allows us to treat patients a lot more effectively. And I should also say, I would be remiss to say that it is a team sport, okay? So we have a lot of people helping the patients along their journey. We've got therapists and technicians, we've got dosimetrists and physicists, and a whole slew of very, very compassionate people, particularly at New Mexico Cancer Center.
And we are absolutely evolving for sure medically in this field. Talk to me a little bit about your background.
I'm actually a New Mexico native as well. I was originally from Las Cruces, and then I came up to Albuquerque, did a huge chunk of my education and my training up here. And then went out to the East Coast. I completed all my training specifically in radiation oncology and practice. And then the first chance I had, I kind of came back to New Mexico. There was something about it that just pulled me right back.
Came back home. We needed you, man. Let's talk about what types of cancer you treat at the New Mexico Cancer Center.
Yeah, so we're very fortunate at New Mexico Cancer Center to essentially have the latest sort of equipment and technology to be able to treat cancers essentially from head to toe. And for a lot of these cancers, the radiation treatment is actually the definitive or the curative treatment for that cancer. So things like lung cancers, prostate cancers, and skin cancers, the radiation treatment is all you need. And for other types of cancers where we're not necessarily using radiation to try to chase after every last cancer cell, it's actually equally as gratifying when we have a patient who has a particular tumor that's causing them a lot of pain or bleeding or other discomfort or problems, and then we're able to use focused radiation treatments to sort of alleviate their pain or their bleeding. And so by doing so, we're able to really improve the patient's quality of life.
You guys are unique with regards to what you offer when it comes to treating skin cancer. Talk to me about what makes you unique and what you offer.
Yeah, absolutely. So once again, we're very, very fortunate at our center to have the full sort of gamut of techniques to be able to treat skin cancers. We're the only center in the state to have a specialized piece of equipment that actually allows us to treat the skin very, very superficially. And we're able to treat the skin, cure the cancer at a rate that's equivalent to the alternative, which is a surgery. But the benefit is that we typically won't leave a permanent scar that a surgery may leave. So for patients in particular who have skin cancers in cosmetically sensitive areas, it becomes a very attractive option because we're able to cure their cancer but avoid leaving a scar. So, and then in addition to that, we're also the only center and actually one of the few places in the country who offer a clinical trial which actually allows us to insert seeds into the skin cancer and do so with just a one-time sort of one-trip procedure that's done as an outpatient. You come in for a few hours, you go home the same day. And so for our patients in New Mexico who are coming from hundreds of miles away trying to seek care, it allows their radiation treatment for their skin cancer to be a lot more convenient.
Non-invasive, which is what so much of us want. If someone wants to, if they're looking for this non-invasive, way to treat their skin cancer, how can we go about getting evaluated?
If you're ready for a formal consultation to go into more detail and actually explore all of the options, The easiest way to get set up is to actually talk to your primary care or your dermatologist and have them place a referral, and then our new patient coordinator, Kristen, will reach out, and then we can find the option that's best for you.
Awesome. A lot of amazing information right there. Dr. Chris Shukla, radiation oncologist at the New Mexico Cancer Center. Thank you so much for joining us today.
Thank you so much. For more information, please visit nmcancercenter.org or call our clinic at 842-8171.